Well, it is a big mark, but it is not a mark. The final scar which happens is planned pre-procedure according to the bikini line of the lady. For the lady, it is really important that she gets a flat and a toned abdomen. Post-pregnancies, many women suffer with bulging tummies, hanging lower abdomen skin, weak abdomen muscles, sometimes an umbilical hernia. So for these women who are struggling, they are dieting, exercises, and all of it is not getting that abdomen pouch inside. For them, a tummy tuck is really important. A scar is not so important, and a scar can fade away over a period of few years. Usually most of these women also have a C-section scar line. So the tummy tuck scar exactly on the same place as a C-section scar line and extend it a little bit to either sides. And it's a very fine line, fades over a period of time within the bikini line. So well, a tummy tuck makes a lot of use for a lot of women. Yes, it is absolutely necessary to wear a compression garment after any body contouring procedure. It could be liposuction, it could be tummy tuck. The compression garment is key and very essential to counter the swelling and also to provide the final shape that has to come. It is worn for usually 2 months. If the swelling persists a little longer, we tend to see the patient on follow-up and decide whether they need to wear it any longer, but 2 months is usually the time. The first month, most of the swelling tends to regress and you have to wear it 18 to 19 hours in 24 hours. The second month, if the swelling has come down, then I usually tell my patients to wear it about at least 8 to 10 hours a day, even in the second month. And in the second month, we provide a much tighter compression garment, so the shaping is better and it also helps in the swelling finally. After a tummy tuck surgery, patients are made to walk on the same day of the procedure. We try to get them as active as possible, as soon as possible. Usually the patients stay for 1 day overnight or sometimes 2 nights with us. When the patient go home, we ask them to try to perform all their daily activities as much as they can. They tend to have a lot of stretching sensation and a feeling of tightness and of course some discomfort the first 4 to 5 days. So definitely initial 2 to 3 weeks you can just go for daily walks, 15 to 20 minutes to start with, and then increase the pace of your walk depending on how your pain is and how comfortable you are. Heavy lifting, heavy workouts, high intensity workouts only after 6 to 8 weeks, because in a tummy tuck surgery we also perform the muscle repair of the midline, and the muscle itself takes about 8 weeks to heal. So high intensity workouts only after 6 to 8 weeks. Core abdomen exercises can start at about 4 to 5 weeks. Post-operatively, after a tummy tuck surgery, obviously you will be having a very tight dressing on your abdomen along with a belt. We also keep these small pipes, or we call drains, at the front of the abdomen at times. Depending on how long your surgery is or how major the tummy tuck is, you either have to stay for 1 night or 2 nights overnight. Definitely the first 3 to 4 days you feel a lot of discomfort because the abdomen is suddenly compressed in and there is a little bit of pricking sensation and burning at the stitch lines. So we ask you to walk with a little hunch. Generally the stitch healing time is about 2 weeks, and that is the period where we observe the wound very closely to make sure it is healing perfectly. You can start walking on the same day. You will go home in a day or two, and there is no need for bed rest. Post-op measures is just keeping your wound absolutely clean, wearing your compression garment, and starting massages, which we will advise you after around day 7. For a post-tummy tuck surgery, for it to heal completely, now we look at it 2 ways. One is the healing of the stitches, which is very important and crucial, and that takes about 10 to 14 days. The second aspect is the swelling, bruising, which is obviously a normal healing response for anybody. So anyone undergoing any surgery will have swelling, bruising, etc., which takes anywhere from 4 to 5 weeks or sometimes even 6 to 8 weeks. It depends from body to body. You can go about your daily routine and normal work routine after 7 to 10 days. For the stitches to heal, we wait for a period about 10 to 14 days, and during that period we need to observe the wound, make sure there are no infections and you are taking care of the wound, dressing it well. And at 14 days, when we see that the wound has dried up nicely, we believe that it has healed completely. For the overall swelling, etc., to heal, it is going to take 4 to 6 weeks. For your final results, takes about 2 to 3 months. Well, it is 100% safe, and that is why it is one of the most popular procedures performed not just in India or by me, worldwide. an abdominoplasty, as we medically call it, or tummy tuck, is probably one of the most popular cosmetic procedures for your mid-torso contouring, not just for women, but also for men who have undergone massive weight loss and have sagging skin and fat in the lower part of the belly, or who have weak muscles in the midline. It is definitely painful. It depends on, pain is a very subjective thing from person to person. Somebody could have a high or a low pain threshold, but the first 3 to 5 days is where the discomfort is. But right from the first or second day, we make the patient walk and make sure they're a little bit active. So the more you are a little bit active and moving around, pain starts to get better by day 2, day 3. I don't advise any bed rest. I like the patients to get on their feet, and no matter how much pain, try walking and be active as much as possible, faster. The discomfort is usually there for about at least 4 to 5 days. The first 24 hours and the first night especially would be the maximum discomfort. We advise you to sleep in a position where your knees are slightly bent or your upper half of the body is slightly raised up. So in that case, the tension on the stitches will be reduced and the discomfort would be much less. For the first 4 to 5 days, we advise you to walk with a little hunch to minimize the tension on the stitch line and thereby reducing your discomfort. But usually after 48 hours, we always see patients getting better, and they always tell us that they're feeling better each and every day. So I guess don't worry too much. The discomfort is for the first few days. Pain medications are provided to give you relief from that discomfort. Do not expect a 100% pain-free period, but yes, the pain medications do help a lot.